Again, I just want to let folks know that there is a Q&A box, and if you have any questions, please use the Q&A box and rather than the chat to ask your questions, and that way you'll be able to see a response easily. So again, thank you for joining. I am going to introduce Dr. Christy Snuggs, Interim Director of the North Carolina Division of Child Development and Early Education now. Christy, would you like to introduce yourself?
Thanks, Madhu. Good morning, everyone. My name is Christy Snuggs, and I am the Interim Director with the Division of Child Development and Early Education. And I am joined this morning with some wonderful colleagues that you'll be hearing from a little later in the webinar. Ms. Jackie Simmons, who is the Project Director with the North Carolina Child Care Health and Safety Resource Center, and Amy Peterson, who is a state child care nurse consultant. We are pleased to be with you this morning, and I am just thrilled to have my colleagues with me to share a little bit more about COVID-19. So as we get started, I would just first like to thank all of you who are attending the webinar for everything that you have done over the past 2 months. I received a video this morning from Secretary Cohen, and it was just amazing that we've been 2 months into this, and she wanted me to share with you all how much she appreciated the work that child care providers have done across the state. We are the workforce behind the workforce, and I think that we are finally getting some recognition for the great work that each of you do each and every day. So I can't thank you enough for everything you've done, for being there for the essential workers as they went out to fight this illness. And thank you for being there for their children. And thank you for what you do each and every day. So we've got a pretty full agenda today. What we would like to do is I want to briefly go through the phases of reopening that we have started now in North Carolina. And then I want to really get explicit about what that means for child care, and also talk about some of our changes in policies, any of the updates that we've made. And then the latter part of the webinar, we will spend with Jackie and Amy, and they will talk more about the health and safety guidance, which I know many of you have questions and concerns about. There will be a moderated Q&A session at the end of this call. It's a pretty tight, packed agenda. So I would just ask that you please pay attention and listen. We're going to be giving a lot of information, and maybe if you have questions, we do have a Q&A set up that you can type your question in, but I would encourage you to listen intently because many of the questions may be answered as we go through the webinar. So, as most of you are aware, Governor Cooper has implemented a 3-phase plan for reopening North Carolina. And as of last Friday, May 8th at 5 p.m., we entered phase 1 of that reopening plan. So if we could go to the next slide, what I would like to talk about is this is the current phase that we're in, and I want to give you some updates of what this phase really means. In general, what it means is that the stay-at-home order still remains in place. But the good news is that people can leave their home for commercial activity. That means that we have more retailers and services that are opening up, but the ones that are opening, it's on a limited basis. They're still having to implement social distancing. They're having to do more strict cleaning protocols and other safety protocols to keep the public safe. We still are limited to no more than 10 people in our gatherings. And one of the big things that has changed with phase 1 is that we are recommending face coverings if you are out in public. And I don't know about you all, but I've been out some, and as I've been out, there's some people wearing face coverings, but not everyone. And I think, I know for myself and for you, I would encourage you to wear those face coverings to keep yourself safe, but also to keep others safe as well. And we are still encouraging teleworking from the state level. So most of my staff are at home, working from home, and I'm sure there are many folks across the state that are still teleworking if at all possible. But we realize that not all folks can do that. They cannot telework from home. Many of our essential workers have been in the field the whole time, and now we have others who are returning into the workplace. And as a result, there's some specific issues related to childcare, and I wanted to talk to you a little bit about what this current phase means for childcare. Childcare facilities may be open only if they operate in full compliance with the DHHS guidelines. They can now, though, serve any child of a worker. So it's not just essential workers anymore. It's anyone who has gone back into the workforce, anyone that is looking for work. There are still some specific businesses that are closed with the executive order. So not those, we're not able to keep those children yet, but anyone who is leaving the home to go back to employment or seeking employment, we are available to keep those children. And of course, as we have done throughout the process, we want to continue to serve children who may be receiving welfare services, and also any children who are homeless or living in unstable living environments. So phase one, when he rolled out the phases, as the Governor Cooper rolled out the phases, each of these phases are going to last about 2 to 3 weeks. And the hope is that we will be able to move into phase 2 somewhere around May 22nd. The governor and many of our teams here at DHHS are closely monitoring key metrics around the number of cases, the number of hospitalizations, the percent of positive cases, to determine whether we are really making adequate progress to move into phase 2 by May 22nd. And so our hope is that we are, but as we move into phase 2, what's going to happen there is that there will be a lifting of the stay-at-home order, but there will still be strong encouragement for vulnerable populations to remain at home. During phase 2, there will be limited opening of restaurants, bars, and other businesses, but they're going to have some very strict safety protocols in place, and they're probably going to be operating at a reduced capacity. During phase 2, there hopefully we'll be able to allow the gatherings of houses of worship and entertainment venues, but again, we are going to have to look at reduced capacity as we begin to open up in phase 2. We'll be able to increase the number of people at gatherings, but again, maintaining certain health and safety protocols. We really are going to have continuous, rigorous restrictions on nursing homes and congregate care settings because this illness has really, really hit those areas hard. But childcare will be fully open, we anticipate, and but they're going to continue to have to meet health and safety guidelines and other protocols that we've put into place. After we're in phase 2 for a couple of weeks, we hope, at least 4 to 6 weeks, we hope we'll be moving into phase 3, and during phase 3, the restrictions will be lessened even more. Hopefully vulnerable populations will be able to go back out and engage in more activities if they continue to practice social distancing. There will be allowed increased capacity at our restaurants and our bars, our other businesses that have been closed, houses of worship and entertainment venues. We'll be able to hopefully get back to having larger number of people at gatherings, but there will still be a lot of rigorous restrictions in place around nursing homes and congregate care settings. And childcare, we anticipate this happening sometime in the June timeframe, and we anticipate by this time that many of our childcare facilities will be back open and operational. So that gives you a quick overview of what we're anticipating as we move forward with the phases. Please note that for all the phases, it's important to know that our state needs to continue to make progress on those metrics that I mentioned earlier, and in order for us to keep moving forward. It is possible that if we start to see some trends going in the wrong direction, that we may have to stay in these phases a little longer than we anticipated at the onset. But the governor and the DHHS team is closely monitoring these efforts, and we hope we'll be able to reopen according to the plan that has just been laid out by the governor. So with that being said, what I'd like to do now is to shift to some updates about reopening for childcare, and also share some great news about some updated payment information that childcare facilities will be receiving. So I mentioned to you that the governor, we entered into phase 1 of the governor's plan last Friday, and with that, the division has launched a COVID-19 child care provider reopening application. One thing that I want to make clear here is that any provider who was closed prior to May 8th and plans to reopen must submit this reopening application. So the main reason we're asking for you to resubmit this is so that we know who's opening up, so we can reach out and provide technical assistance and consultation to help you in this process. And it's a way for us to track what centers are open, because we're constantly being asked what percentage of child care is open and operating, what's their vacancy rate. So this is just a way for us to help track, and it's also a way for us to help you get the resources that you need to open. We ask that if you are going to reopen, that you give us about 48 hours advance notice so we have time to make contact, answer any of your questions, and help you as you're beginning that reopen process. So the way the process works is you go online. There's been information sent out about the reopen application. You go online, you complete that reopen application, you'll get an immediate email back that tells you you are approved to reopen. And then within the next 2 days, your child care consultant will reach out to you to discuss the updated health and safety guidance and your plan on how you're going to meet those guidelines. After they have that conversation with you, they're going to issue all new centers that are reopening a health and safety certificate. We ask that you post that certificate in your child care facility so that parents know that you're adhering to the highest health and safety guidelines that the state has recommended, and give them a little bit of a sense of security when they leave their children. One thing that I do want to mention is that child care providers who were already opened during the month of April or already open in May, and you've been open and you've been operating under the emergency provider, child care provider application, that is fine. You can continue to operate. You do not need to complete the reopen application. This is only for child care facilities that have closed and are planning to reopen. The other thing that I would mention, if you have been open and serving as an emergency child care provider, you will also be eligible to receive the health and safety certificate, and your consultants will be reaching out to you as well to talk through the updated guidance, and you will also receive that health and safety certificate. Please be patient with our child care consultants, because they're going to be working with the new child care providers that are reopening, as well as working with those who have remained open, but they will get to you just as quickly as possible. And as part of this reopening process as well, the child care consultants will be making a few on-site consultative visits. These visits are intended to be resource visits to help you make sure you're implementing the health and safety guidelines. It is not a punitive type process. We really want it to be a consultative process. On the next slide, I have a quick picture of what the reopening application looks like. There is some wording up here at the top that just talks about the reopening process. It also mentions that child cares can reopen, and it also talks about implementing the new health and safety guidelines as well as the new regulatory flexibilities. I do want to mention here that we've had some regulatory flexibilities in place, but hopefully you are all aware that we have updated those. And by updating those, what that means is we are reverting back to normal operating procedures on many things. That means you need to now maintain, as of May 11th, you need to go back to your normal child-staff ratios, your normal group sizes. You also need to adhere to square footage requirements. There are still some flexibilities around collecting documentation of new children entering their health documentation, also some of the new documentation for your new workers. The one thing that has not been waived, you still have to have that criminal record check prior to employment. And I will just mention that many of our fingerprinting agencies have been closed over the last several weeks, but they are beginning to open back up. Earlier this week, it was reported to me that about 41 of the sheriff's departments are again doing fingerprinting, but you have to make appointments. So it is a little frustrating, I understand right now, but we believe that as we go more into the reopening process and get into phase 2, that more of those law enforcement agencies will be open and you will be able to do that fingerprinting. But I did want to bring that to your attention that some of the regulatory flexibilities that were in place have now been rescinded, and you will need to go back to doing regular child-staff ratios. There is a link here of where you can find the application in case you don't have that link handy that went out with the communication. And the only other thing that I would mention is that there are some declarations that as you reopen, if you've been closed, that you will have to adhere to. And if we'll go to the next slide, we'll talk through what some of those attestations are that centers need to agree to reopen. One of the things that we're asking centers to do is to make sure that they meet all the updated health and safety guidelines. And so we'll be talking through those in just a few minutes, but that is one thing that all centers that are reopening or remaining open needs to adhere to. Centers also have to attest that they have adequate staffing to meet those health and safety guidelines. That means that you're probably going to need, if you've laid folks off or people have been working limited hours, they may need to come back as children start to re-enroll to meet those health and safety guidelines. We also are asking that centers have adequate supplies and resources to conduct the daily screenings and the daily health checks, that there's plenty of hand washing stations, you have paper towels and soap, and you have proper disinfectants to do cleaning. We also ask that you have adequate resources to feed the children. And one other thing that we're asking you to do, and those of you who have been operating know that we have a daily provider survey that we're asking you to go out and report your attendance and vacancy information on. That is available on the website, the DCDEE website, the link to that survey. In many of the communications that have gone out, we've provided that link. But if you have problems finding that, please reach out to your consultant. We also are asking centers to waive the subsidy parent co-payments for any of the subsidy children that they are serving. And we're also asking that providers provide bonus payments to teachers and staff funded by us through the month of May, and we'll talk more about bonus payments in a few minutes. And then also, if there's ever a point that you cannot reach meet any of these requirements, that you reach out and work with your licensing child care consultant to make sure that you can meet these requirements. So the next thing that I'd like to talk about is we are so thankful that so many of the programs were open during this pandemic and were offering child care. And we know that those of you who were open, and even those of you who chose to close and are now considering reopen, we realize that you've suffered significant financial losses during this time from reduced enrollment and reduced revenue. So we are very excited to announce that we will be providing operational grants for open child care programs and for programs who are planning to reopen during the months of April, May, and June. Now, what that means very quickly is that if you are operating in April, then you qualify for a grant for April. If you are operating a partial month of April and remained open, then you are eligible for a grant for April. If you've come back on in May, you're not eligible for the April grants, but you're eligible for the May grant based on when you reopen. These grants will be prorated if you're opening. I know we have many child care facilities. We have about 80 that we're aware of, maybe a few more now, that are coming online on Monday or opening back up to serve children, and they would be eligible from May 18th forward for the May operational grant. If you decide that you want to open in June, you would then be eligible for the June operational grant. If you've been open the whole time, then you would be eligible for April, May, and June. The whole purpose of these grants, they're intended to help cover monthly fixed costs. We know that you still have to pay mortgages and rent, your light bill, and all of those kind of things. And so that's what these grants are intended for. They're for fixed costs and any other operational costs that you may have from these lost revenues that you've had. This is a grant program, which means you're going to get the money. You don't have to apply for it. It is not a loan. You don't have to pay it back. It is money that we are providing for you, and we are glad to be able to do it. The intent is to use it for fixed costs, but it really is for you to use in any way that you see fit to make up for those lost revenues. And the other thing that I will mention about this grant is it is available to all open programs, regardless of whether you receive subsidy or not. Whether you've received subsidy in the past or currently receiving subsidy, it is open to all programs. Moving on to the next slide. These operational grants will range from about $500 to $30,000 per month for centers, and from $359 to $2,500 for family child care homes. Now, that seems like a big range, but the reason there's such a range is there were multiple factors that went into determining how much money a facility would receive. One of the first things we did is we wanted to ground this formula in research and in data. So we used national NAEYC data that they had done surveys on to say what the operating costs were for child care programs. And then we looked at a number of factors that are listed here on the slide. We looked at the total number of children that each of the facilities was serving prior to COVID-19. So we wanted to give you credit for what your center normally or your home normally serves, the number of children. Of course, if you serve more children, you're going to be eligible for more money. Star level. We also looked at the quality indicators of your center. A 5-star facility takes a lot more money to operate due to the lower staff ratios and the other quality enhancements that are required. Therefore, 5-star centers would get a higher funding rate than a 2 or a 1-star center. or any of the others in between. We also looked at serving children. We looked to see whether the facility had served children and families receiving child care subsidies over the past 12 months. Our funding came from the CARES Act, and the CARES Act is an extension of the Child Care Development Block Grant from the federal government. The intent of those dollars in non-emergency cases is to be used for low-income families and children at high risk and those that are homeless. And therefore, if you had participated in the program of subsidy prior to this, then you were given an advantage in the formula there. We also looked at your subsidy density to see how much or what percentage of the children that you enrolled in your facility were receiving child care subsidy. And the reason that was looked at was because if your 50% of your children receive subsidy, we have been trying diligently to get those subsidy payments to you, also covering the parent copays. So you're being funded for those children, and this grant would make up for those children that were private pay that you were not receiving revenue for. And then the other factor that we considered was your infant toddler enrollment, because we know that if you have large numbers of infants and toddlers, or anytime you serve infants and toddlers, the ratios are so low in those classrooms that it does cost a lot more to run those. So we gave you a percentage based on that. So these were the factors that went into calculating the amount of the operational grants that programs will receive. Every program, we'll move on to the next slide, every program that was open and will reopen is eligible for these grants. The way we determined if you were open is if we have an emergency child care application on file for you, or you have completed the reopen application. If you've not done either of those, we have no idea if you're open or closed if you've not reported to us. So we've asked that you please complete those applications. We also are checking to make sure that you're entering your daily attendance in that daily provider survey. There's a question on that that determines if you're opened or closed. So those are the two ways that we were able to determine if you were opened or closed. Programs, I mentioned this before, you do not need to apply for these operational grants. You will receive them. I'm happy to report that for programs that were operational and open in April and have continued to operate through this early part of May, you're going to be receiving your grant next week. That is the plan, is that you will receive your grant next week. Do realize this is a direct deposit that will go into your account. We work with your banks, but your banks have different time limits of when they deposit those funds. So it will hopefully be one day next week, mid to late week, I would say, where you will see these funds in your bank account. If you are just reopening and you have not been open the entire month of April, you will receive your grant from the date that you reopen, but most likely you will receive your grant next month, which will be mid-June. But again, these grants are for April, May, and June, only for open centers. I talked to you about the factors that went into figuring out these grants. And as you reopen, you will be eligible for that time period once you're open for the grant. To find out exactly what your operational grant, the amount of your operational grant, you can email this you can email the DCDEE communications email, or you can call this number that's listed on the slide. And we have several of our folks who are manning these lines and manning this email address, and they'll get back to you just as quickly as possible. Please allow them at least 24 hours to get back to you, because we know that the number of calls and emails are going to be overwhelming, and they're going to get back to you as soon as possible. But hopefully, many of you who have been working will get these operational grants, and it'll be a nice way for you to help offset some of that lost revenue. So moving on, I'd like to shift gears to talk just briefly about the Child Care Subsidy Program. As I have mentioned, we paid you for the full amount during March when we shut down, and then April and May payments, we're paying subsidy based on what your enrollment was for February. And if for some reason that you cared and your subsidy enrollment was higher for April or May, there will be an adjustment made there. But most people are getting their February payment because that was the last full month that we were in attendance. But we've been doing that for all providers during the months of April and May, whether you were open or closed. And we've been covering all the parent co-payments for providers, whether they were opened and closed. There is a shift and a little bit of a change that's going to be happening for June. We will continue to pay child care subsidy payments based on February enrollment for June, because we don't believe that every child will be back in your facility by June. But it's only for open providers. We will not be paying closed providers during the month of June, because we figure most of you are going to be reopening, and therefore you would be eligible to continue to receive subsidy. But we will be paying subsidy payments for open providers based on your February attendance, and we will also continue to pay parent co-payments for open providers. All right, moving along. The other thing that we were able to do during the months of April and May is we were able to stand up an emergency child care subsidy program. This was a program for essential workers. You may remember, if you were open, you had the parent had to fill out a parent application, and on that application they had to attest to 3 things: that they were an essential worker, that they had no other child care arrangements, and that they were income eligible, meaning that they made below the 300% poverty level. We are happy to report that in April alone, that's the month we have data for currently, we served over 17,000 children of essential workers, and we were able to do that because of all of you who are out there on this call. Thank you, thank you, thank you for serving those children of essential workers. Because of Executive Order 138 that was implemented by the governor last Friday, that order removes the essential business designation, and therefore providers are no longer going to be able to enroll new children in the emergency subsidy program after last Friday. The reason for that is there's no distinction of an essential worker anymore. So if you were serving emergency children in April and you're still serving those children, you will get paid for May for all of the children that are enrolled. You just will not be able to enroll any new children after May 8th. So you'll continue to receive that payment. You will get it in mid-June like you received the one for April this week. You will get that money in June. You just can't enroll any new funds. This emergency child care subsidy program will end on May 31st. We are sorry that it's ending. We would love to see this continued, but that is not something we're going to be able to do with the current funding that we have. I encourage each of you, if you are serving emergency subsidy children, to notify your parents, let them know, encourage them to enroll in regular subsidy if they think they meet the eligibility criteria. But we are not going to be able to continue to fund this program after May 31st. Moving along. The last thing that I'm going to talk about, and then I'm going to turn it over to Jackie to really talk about the health and safety guidelines, are bonus payments for employees. Hopefully, many of you who have been open and operational received your bonus payments this week. And I know some of you had already paid for your teachers and your staff, but hopefully you were able to do that this week if you have not done that before. We issued bonus payments for April. Those came out this week. You should have them by now. We are also going to issue bonus payments for the month of May. This is for full-time and part-time employees. The amounts are there on the screen. I think most of you are aware of those. And the other thing that we were able to do to help providers is we added an additional 10% on top of the bonus payments, so that would help you to cover any cost associated with your payroll taxes on the provider side and any administrative or overhead costs. Do understand that, and teachers need to understand this, that we are giving you, if you're a full-time teacher, $950, but you still have to pay your payroll taxes out of that on your side. So you may not receive the gross amount of $950, but you should receive a significant bonus. All teachers and staff in programs that are currently open or will reopen will receive this bonus. So what that means is if you have been closed and you plan to reopen on Monday, May 18th, your teachers will be eligible for bonuses for the time that they're working. Remember, these bonuses were only for people that were, for facilities that were open, and the teachers and the staff were on site working with children. That means you were serving children, not that you were there planning or cleaning and all of that, but that you were actually working out on the front line serving children during the month of April and May. And then the last thing that I would like to do, if we move on to the next slide, is to mention that we were also able to establish a child care hotline during this process. It is, the number is there, 1-888-600-1685. It is open 8 to 5. This hotline is continuing to operate, and it's there to connect families to local child care options. So make sure, that's another reason that you want to make sure that provider survey is done daily, because we are sharing that information with our local R&R network. We're in collaboration with them on this, our Child Care Resource and Referral Network, and they are then referring folks to your facilities. So please make sure that information is updated so that we can refer them to your facility. And so with that being said, I am going to turn the mic over to Jackie, who is going to provide updates to the health and safety guidance. Jackie?
Hi, thank you, Chrissy. I appreciate it. I'm going to try to get through this health and safety guidance quickly. So if you do have any additional questions, the biggest resource that I will talk about is your child care health consultant that has been assigned to your county during this time. I work with the North Carolina Child Care Health and Safety Resource Center. It's a program of UNC Gillings School of Public Health, and we support the Child Care Health Consultant CCHC network. A CCHC has been assigned to your county during this time, even if you don't usually have one. There's someone been assigned. So please, we welcome you to please visit our website, and links are on this slide to find out who your CCHC is and connect with them. If you have been closed since March, we recommend reading the health guidance very carefully and completely and reviewing and posting the newest door sign. That sign was updated probably last week, if not the week before, and it's a little bit different based on the symptoms that list that changed from the CDC. If you have any trouble getting questions answered, we do welcome you to come to our website. There is a web form you can fill out and submit questions. We do have a 1-800 number as well. It's just voicemail these days, and then we will respond to that voicemail as it comes in because no one's in the office right now. We recommend that you take a day, or if not two, to review the guidance with staff and families prior to opening and not just open the doors when you can. This is something that a CCHC can assist with. Health guidance has evolved and continues to evolve. And so keeping up with what's newest is important with all of this. It's really changing fast. All right, next slide is on the daily symptom screening, and I'll talk a little bit. What I'll say is that I'm going to talk about the changes to the health guidance because I can't possibly get through all of the health guidance. I know that you all are going to talk about this with your child care consultant, and then again, reach out to your child care health consultant if you have additional questions. As you are probably aware, child care programs that are open or plan to reopen are required to conduct daily screenings of staff and children And I recommend everybody who walks in the front door of the facility. So anyone that comes in should be screened. Facilities have the option to do temperature taking as a part of screening. It is not the only part of screening. I want everyone to be mindful that there are subjective signs of illness and fever. So a child that comes in that may only have 100.2 fever, so doesn't meet that threshold of 100.4 on that's listed here. If they are sweating and clammy and not able to participate with the other children, they're clearly showing signs of illness and should not be in the facility. So please take that temperature reading as one of the steps of the screening process. The other thing is screening does not only need to happen at the first, at the entrance, at drop-off. That should be happening throughout the day. So if a child's health declines throughout the day, that child should also be removed from the group and sent home. And same goes for staff. All right, so next slide is talk about the updates to the health guidance. The great thing about the updates is that they are in red. If you look at the documents, you can, if you've looked at it and followed it carefully, you'll know what's changed. First of all, social distancing should be practiced with families and staff at all times. That means up at the front, avoid congregation of anybody. I know it's going to be nice to see folks again and colleagues, but really that can't happen at this point. Floaters. I know floaters are very helpful in childcare, but really the goal for childcare is to limit the number of children and staff that are in a classroom. One floater is recommended to be used so teachers can have a break, use lunch, use the facilities, but trying not to have more than one floater, or at least have the least amount that can keep children in ratio throughout the day. It's recommended highly by DHHS to have flexible sick leave and paid leave policies, and this is to encourage folks to stay home when sick. Having signage with 6-foot space markings in waiting areas is highly recommended. Again, practicing social distance at all times. Ventilation is important, ensuring ventilation systems are cleaned routinely, operate properly, and increasing the circulation of outdoor air as much as possible by opening windows with screens, of course, because the child care rules still apply, but using doors, fans, or other methods that might keep that circulation of air going. Don't open windows or doors if they pose a safety or health risk to people using the facility. All right, next slide. Additional cleaning guidelines. Listed instructions vary dependent on the situation. Consult with a CCHC or environmental health specialist, or especially the local health department if there's a case or potential case of COVID in the facility. Clean and disinfect shared tools, supplies, and equipment. Allow time for cleaning between activities. Minimize use of shared supplies and label individual supplies and items, and routinely check and refill or replace hand sanitizer at entries, and make sure there's adequate soap and paper towel in bathrooms. In planning to reopen, staff should be trained, families should be communicated with, and there should be enough slides available, including bleach, paper towel, and soap. Bleach, paper towels are the most important things for cleaning. If you have nothing else, those are the two things that are going to suffice in keeping the facility disinfected, and of course soap. In terms of personal protective equipment, you will want to wear gloves. What we're calling cloth face coverings, or CFCs to just shorten it, is what we're saying instead of masks, because masks indicate medical masks, and that's not what we're recommending. It's not what's recommended by the CDC. And if you're doing fever checks or temperature checks, at the front, you'll want a thermometer as well. I'm going to talk about this cloth face coverings a little bit more in the next few slides. Planning ahead in case the facility does need to close. If there's a case or suspected case, we recommend that you do not make that decision on your own, that you talk to the health department. Most likely it will be a CD nurse, communicable disease nurse, and that you bring your child care health consultant into that conversation so that they can help facilitate that communication amongst the health department and help if they are hard to get a hold of right away. I know that all of the folks in the health department are very overwhelmed. In terms of screening, the screening guidance at the front door has not changed. So if you've already been screening, you should know what this guidance is. And if you haven't, read through it carefully. The steps are laid out clearly. But we recommend that the protocols be followed carefully every day, throughout the day. And that is remain consistent throughout this whole process. The next, we'll talk about that, as I said, the cloth face covering, CFCs. They should be worn. The 2 times they absolutely should be worn. Absolutely is when you're screening children before you know that they are screened for not having illness or not showing signs of illness. And so the person who's screening should absolutely have a cloth face covering on. And then if a child or staff member is showing signs of illness throughout the day, they should absolutely have masks on if you're working with that child. No children under the age of 2 should ever wear a face mask under the age of 2. Age 2 and above should be able to wear a face mask only if it does not cause them to touch their face more frequently. And they must be able to remove the cloth face covering by themselves. No cloth face coverings for a child who has trouble breathing, or if the cloth face covering is a possible choking or strangulation hazard. It's not recommended for outdoor learning times having a cloth face covering on, because children are able to socially distance and spread out more easily. And that is all I've got on that. I know that there are probably a lot of questions, especially when it comes to the cloth face coverings. So please, again, work with your CCHC or get in touch with us at the Resource Center. We have guidance at the Resource Center on our website on cloth face coverings, and I think the link was on that first slide that I talked about. That is a compilation of CDC, American Academy of Pediatrics, and put together in one place. So I highly recommend that if you do have questions, to look through that document and then follow up any additional questions with your child care health consultant, or as I said, you're welcome to get in touch with us about that.
Thanks, Jackie. I do want to get to the questions, guys, and I have been monitoring them as well as some of the other colleagues on the line. So I'm going to address a couple, and then I'm going to turn it over to Amy and Jackie to address the health and safety. But I do want to address a couple that I've seen related to programmatic things. I do want to clarify that, yes, you need to read the communication that came out about regulatory flexibilities. Regular ratios did go back into effect this week, May 11th. Now, again, we're going to work with you through these first couple of weeks or so as we're engaging in these phases, but we are encouraging you to go back to using your regular ratios for whatever STAR level you're operating under. And that brings up the question about 10 children in a classroom. I saw that several times. Child care has been considered under all of the governor's executive orders as essential. So we have never been restricted to those 10 children in a classroom. And there's also questions around social distancing. I recognize that it is going to be very, very difficult, as Jackie just mentioned, to keep children socially distanced. So what we're recommending is that you do your best with that. But the way you social distance in child care is to limit exposure as much as possible. So you want to keep same groups of children together, and you want to keep the teachers that are working with those children to be a limited number. We realize you have to relieve teachers for breaks and things of that nature, but you don't want a whole lot of different people rotating in and out of classes. Again, you want to plan activities within your classroom that the children don't have to be up and on top of each other all day. One of the things that talks about in the health guidance is to have ventilation in your classroom, if you can open windows and things to have outside air to come in. Those are the types of things that we're wanting you to do within your child care facility. And you do not have to maintain those 10 children. If you're able to do smaller groups, you've got enough staff, you don't have full capacity of your children, you could do that. But again, you want to maintain the same groups of children together as much as possible. There were a couple of questions around half-day centers. The information that I provided today is for licensed facilities. Many of our half-day programs are not licensed. However, we would encourage you to follow the same guidelines if you are operating, because this is only great information and ways to prevent the spread of the virus, correct, Jackie? So we would definitely want you to follow those. You would not necessarily receive a certificate unless you're in our system, but if that's something you would like and would like to reach out to us, we can see what we can do, but that you would not be in our traditional group of folks unless you are in a licensed facility. One of the other issues that's happening for those of you who have been operating as emergency child care providers, you've been, what you had to attest to is that you would serve essential children. And you also had to attest that once the emergency order is lifted, you would begin to accept your regular children back. So I know there's concerns about, you've got emergency children that may be from other centers, and now you've got these new, your regular children wanting to come back. We believe that it will work itself out from the standpoint that we don't believe everybody's going to come back all at the same time with your ratios. It may impact certain classes worse than others, and that's where you really need to work with your child care consultant as to what the best arrangement might be. We also believe that many of those emergency children that you're serving, as new centers open back up, many of those may be leaving and going back to their normal facilities. So we just ask that you work with your child care consultants to work through those situations. We are not coming in and citing you for that right off the bat, but we do want you to understand that you need to start thinking about maintaining those ratios, and again, work with your child care consultant to figure out how to do that. And then the last thing that I would mention is we do have a whole section under COVID-19 on the DCDEE website. There is a document out there called Payment Policies. Some of you are asking questions about payments, and are they there for April and May, and maybe you didn't catch what I said. Please note that all of that information is available in that payment policy document, and it is available on our website under COVID-19, and we just updated it this morning, so a new update will be posted today. So if you have questions related to that, jump back and read that. So I'm going to turn it over to Amy and answer any health and safety questions in our last few minutes.
Hey, this is Jackie. Amy, can you please jump in and help? Amy is our is the state child care nurse consultant, so she's got her nursing background. I'm not a nurse, but what I can say about the mask, I want to apologize if it was a little bit unclear, but the required use of a mask is at the front, greeting families, greeting children. And when a child or staff person becomes sick, being with that person. It's not required otherwise in the facility after the screenings happen. That is optional. What the guidance says is teachers should wear it when feasible, and children can wear it if they tolerate it, above or age 2 and above. So it's not required once they've been screened in the classroom if they're not ill.
This is Amy. There was a question about mouth toys. Should they be sanitized or disinfected? And so the sanitation rules are still apply. And you should do your regular routine cleaning, sanitizing, and disinfecting. In the event that you have had a positive case in your facility, you would want to work with your local environmental health specialist to get additional information and guidance. I will say that you do, with the Mouth's Toys, that it is also recommended that you can run them through a dishwasher that has a sanitizing option, and sanitation also does approve a disinfectant that's EPA approved that is used on food surfaces. So I think that answers that one.
There was a question about children's personal items, Amy, and I think the best answer for personal items is anything that can stay at the facility and be kept in a cubby should. The fewer things that go back and forth from home to facility, the better. So I understand if they bring their own lunch, it's a different story because they don't have a choice. But if they have a blanket or a stuffed animal that they can just leave at the facility, so it's not going back and forth every day, it's much better. And they keep that separate from other kids and in the cubby, and so they take that out at nap time. So the fewest number of people that are touching that item, the better. Amy, what do you want to add to that? I hope that's right.
I think that's right. There's a question about family-style meals, and that is addressed in the health and safety guidance that during communicable illness, their family-style meals is not allowed. So I think that answers that one.
So, Amy, I'm going to jump in. We only have about 2 minutes left. We know we did not get to all of your questions, but we are going to post this webinar on our DCDEE website. And we also will follow up with some Q&A that will be posted out there as well. I do want to run through just a couple of things as we have just a couple of minutes left. I wanted to remind everyone that you do not need to apply for the operational grant, but you do need to submit attendance to get bonus payments and emergency subsidy payments. If you do not know what I'm talking about, you need to read the financial policies that I mentioned earlier. It explains that, and if you have questions, it tells you to reach out to the subsidy unit here at the division because we've got to get you set up so you can receive those payments, and they are working around the clock to do that. If you were late submitting attendance for April, you can still submit attendance. Your payment will just be delayed. You will get that in the next payment cycle, but yes, you should be able to continue to go and submit attendance, but you need to do that now. I told you we would post it. One other clarification is that for regular subsidy children, if you are open, you will receive that subsidy based on your February payment, February attendance, and you do not charge parent fees for the month of June. We will cover the parent co-payments for June. So we will cover them. The only difference is it's only going to be for those open providers. If you're closed, then the parents, we will not be paying those. So if you are closed, you're not serving them, but that's up to your policies as to whether or not you collect those payments, because we will not be paying closed providers. All right, our time is up. We thank you so much for your time today. We thank you for all the work you're doing. Have a great day. Stay healthy and stay well.